The Next Generation NClex is a comprehensive examination designed to assess the knowledge and skills of nursing students. The case study question is an integral part of the NClex, as it provides a real-world scenario that the student must analyze and apply their nursing knowledge to in order to come up with an appropriate solution. These case study questions are designed to challenge the student's critical thinking, problem-solving, and decision-making skills, and will play a major role in determining their readiness for practice as a nurse. Let's take example. In the current case study, we will cover 6 questions based on the case study given. Please do not forget to go through nurse's notes, physician's order, or lab values while going through these questions. Patient's history. Mr. John, a 65-year-old male, was admitted to the hospital with complaints of confusion, muscle weakness, and seizures. His past medical history was significant for high blood pressure and diabetes. He was on diuretic medications for the past few months. On examination, his blood pressure was found to be low and his pulse was weak. Nurse's note states that at Jan 31, admitted with complaints of confusion, muscle weakness, and seizures. BP is 90/60th ng, pulse, weak mmHg, hypertension, diabetes mellitus, and is on diuretic medicine in Feb 1. The sodium level is 125 milliequivalent per liter. Started on sodium chloride IV infusions. Potassium level is 3.2 milliequivalent per liter. Physician's order reads the following. Sodium chloride IV infusion. Monitor electrolyte levels. Reduce dose of diuretic medication. Dietary restriction of sodium. Lab values of sodium and potassium for the patient are also given over here. First question on case study. What is the most likely cause of the patient's confusion, muscle weakness, and seizures? A. Hypertension. B. Diabetes mellitus. C. Hyponatremia. D. Hypokalemia. E. Diuretic medication. The correct options are C. Hyponatremia and D. Hypokalemia. Hyponatremia is noted in the patient's lab values 125 milliequivalent per liter. Symptoms of hyponatremia include confusion, muscle weakness, and seizures, which are also present in the patient. Hypokalemia is also noted in the patient's lab values 3.2 milliequivalent per liter and can cause similar symptoms. Hypertension and diabetes are present in the patient's past medical history, but are not the immediate cause of the symptoms. The diuretic medication the patient was on may have contributed to the low electrolyte levels, which is why the physician ordered to reduce the dose of the medication and monitor electrolyte levels. However, the main cause is the low sodium and potassium levels.